at Men's Health Network, we have three pillars. I would say we could probably expand beyond some of the comments that my colleagues had mentioned here before. One of the key issues for us in the public policy space that's of concern and of interest at the same time is Medicaid expansion. For us, we view it as both a unique opportunity, but also maybe a potential challenge where there may be some unintended consequences. When you look at the expansion of Medicaid, it's a unique opportunity for us in the men's space because for many years, the way the eligibility requirements were written, many men did not qualify for that system and for that program. So with expansion, there's potential that 60% of the new 16 million entrants into the program could be men, so 40% women, about 60% men that may now have access that did not have access before. So we see this as a very unique opportunity, and we would love to work as much as we can with the states on this Medicaid expansion process because we believe it really provides a unique point in time to maybe implement some of the things that we've seen work with Medicare. So for example, the Welcome to Medicare physical. Even though utilization is about 7% at this point, it's kind of a great benchmark that when any man or woman enters into the system, it's kind of a good baseline to get working with their healthcare provider to understand as they enter the system what are some of the challenges that they may face, or is there opportunities to catch things early or prevent or early detect cancer in many cases. So we look at Medicaid as a very unique opportunity. And then kind of piggyback off of Nancy, essential health benefits are certainly a priority for us as well. I don't want to follow up too much on some of the comments that she offered, but from our lens, we're also very interested to see as essential health benefits moves forward, as states are identifying the benchmark plans. Specifically, are they going to identify and pick plans that incorporate the state mandates that are already existing in those respective states? Just to piggyback off prostate cancer here for a second, 37 states have a prostate cancer screening state mandate. We're interested to see if these benchmark plans are going to follow that, and then if they do not, and the state is required to pick up the tab beyond those benchmark plans, how many states at this current fiscal environment are going to be able to pick up the tab? Probably not too many. So we're very concerned about access to care for women and men to a whole variety of screening and benefits as it results around essential health benefits. And then probably the final pillar for us is when you look at the Affordable Care Act and look at implementation, certainly the United States Preventive Services Task Force is one of those key issues that to be honest, I haven't really met one colleague in the oncology community that likes the United States Preventive Services Task Force. I know our colleagues and friends in the breast cancer community have been continually frustrated by the task force. We in the prostate cancer community were just hit several weeks ago with a grade D recommendation for PSA testing. And it's which cancer is next that's going to be hit by a new task force recommendation that ultimately takes a step back for patients. So right now we're working through a variety of channels with those in the provider community, those in the patient community, because I think at the end of the day we're going to need to reform that process because it's really, we're in a position where which cancer, which community is next to be influenced. So we're looking at a couple opportunities with some congressional champions at the moment to see how we could do better, recognizing that we don't want to replace the task force. We want to see if there's ways that we can encourage them to work with their agency partners a little bit further, like NCI, like NIH, like CDC, as well as convene some expert advisory panels of medical specialists, as well as patient advocates. So those are some of the unique opportunities we see.